Good morning, everyone. And thank you, Dr. Johnson, for that great presentation, and thank you, Helen, for the warm welcome. Again, I'm Dr. Jonise McDaniel, the Public Health Dental Director for the Oral Health Program of the Department of Health. First, I'd like to acknowledge our veterans. Words are not enough to express the gratitude we hold in our hearts for all our veterans. To my late father, James Jeter, and to all the veterans, thank you for your service. Thank you for your sacrifices, for your valor, for protecting us, and for defending our rights. To all our unsung heroes, we thank you. Now, I'm so delighted that we are all able to gather together in person and collaborate and network today. It's been a while since I have been part of a crowd this size, so please bear with me. Before I talk about the program, I'd like to tell you a little bit about myself. I'm originally from Hydesville, Maryland, which is a stone's throw away from Washington, D.C. I attended Temple University for undergrad, then went on to Howard University College of Dentistry. It was there that my passion for community health began. Patients would flock to the dental school with their treatment plans from private dentists in search of a more affordable care. There was never a shortage of patients to go around for competency or board exams, and the clinic was an open door for emergencies as well. Immediately after graduation, I continued my education through a general practice residency at St. Elizabeth's Hospital, also in Washington, D.C. I chose that program for its extensive network of hospital, school-based, and health center rotations. It was then I realized that oral health care is a luxury to many, although we all know that proper oral health is a necessity. I tried my hand in private practice for a short period of time, and I was unhappy. It wasn't my why. Then the opportunity presented itself to jump up and move from Maryland to Pennsylvania and work for an FQHC. The bulk of my career has been within community health centers and school-based clinics. For the past 16 years, I have found great pleasure in working with the underserved communities of Central Pennsylvania. Although my role has shifted a bit, the mission is still the same: to provide optimal oral health through education, disease prevention, and dental health promotion. On a personal note, I'm married to my college sweetheart, and we will be celebrating our 20th wedding anniversary in the spring. I have 3 sons, ages 12, 16, and 18, so that's one in middle school, high school, and a freshman in college. And he decided to attend our alma mater, and he has joined the Army Reserves, so we're really proud of that. Something many people don't know about me is that when I was 13, I wanted to become a brain surgeon. Yeah, you laugh about that. But I think that dentistry and neurosurgery have similarities, okay? Foremost, it's all about head and neck. Anyway, let's get to business and talk about the oral health program. Every state has an oral health program that is established to develop essential public health services to promote oral health. These services are evidence-based interventions and best practices. The role of the oral health program is to provide assessment, surveillance, and policy development. Okay, as mentioned earlier, I'm the dental director. I've been there for roughly 4 months now. And we have 2 public health program administrators, Jan Michelle Miller and Tim Golightly. Jan, if you could give everybody a wave. It's over here. Jan is the lead coordinator of the Centers for Disease Control and Prevention Oral Health Grant and focuses on the operational parts of the oral health program. She has over 23 years experience in public health, and she received her master's degree from Penn State and is certified in public health by the National Board of Public Health Examiners. And then we have Tim Golightly. I think he's over here, if you could wave. Tim is the lead coordinator for the Health Resources and Services Administration Oral Health Grant, which focuses on oral health workforce development, expansion of oral health services, and expansion of oral health infrastructure. Thank you. He has over 21 years of public health experience, including 19 years in health statistics. He resides in Carlisle, PA, with his wife and 2 daughters. We also have 2 consultants, Dr. Andrea Abbott and Dr. Harry Goodman. I'm looking for you out here. Let's see. There's Dr. Abbott. From Heartland Solutions as the evaluator for the Centers for Disease Control and Health Resources and Services federal grant programs operating in Pennsylvania. She has over 15 years of experience in program evaluation, and her work has resulted in millions of federal funding for education and public health projects to support some of the highest need areas throughout the nation, including funds to address the water crisis in Flint, Michigan, hurricane recovery efforts in Louisiana, and funding to support infrastructure and building projects in the Colonas and communities along the U.S.-Mexico border. And we have Dr. Harry Goodman. He's over here. He is a retired Maryland State Dental Director, having served in the position for over 20 years. He secured multiple grant awards for the dental program from the Centers for Disease Control and Prevention and Health Resource and Services Administration. Dr. Goodman developed and operationalized key recommendations to reform the oral health care delivery system for low-income Maryland children. He once served as the Region 3 Head Start Oral Health Consultant and was responsible for training and technical assistance for Head Start programs in a 6-state region, including Pennsylvania. Dr. Goodman also conducted an evaluation of the Pennsylvania State Oral Health Program, which helped the program's prioritize and strategies. And of course, our key partner, PCOH. Helen, Marilyn, Angela, Amy, I know you're all in here. You've helped us with so many efforts that it's just too many to name, but your team has been amazing and you're true oral health champions. Now I'd like to tell you about our oral health program and activities and accomplishments. In August 2020, we implemented a public health communication campaign to focus on the benefits and safety of communal water fluoridation. We focused on counties where communities were considering starting to adjust fluoride in their water or communities who were considering stopping the adjusting of fluoride. We created 6-second and 15-second ads on social media sites and worked with women, infants, and children offices and pediatrician offices to distribute promotional materials to their clients. Over the course of the campaign, paid media delivered nearly 3.5 million impressions, over 11,000 clicks, and over 2 million video views. Also, 15,000 printed materials were given to providers to distribute to their patients. We are currently running a similar campaign, but focusing on different communities, and we are also working with the YMCAs and food pantries to distribute materials. We give community water fluoridation equipment grants to community water systems so they can update their equipment. Another project is our OHP-sponsored school-based dental sealant programs, where we work with school district dental hygiene programs, FQHCs, and local health departments to partner with schools to offer dental sealants to their students. Although COVID has hindered some progress, we currently work with 8 program coordinators and 65 schools, with a goal to reach 5,000 students by 2025. Through our partnership with the PCOH, we have and we will continue to offer many grants to organizations to implement projects that align with the oral health plan. Next slide, please. Some of our surveillance efforts include developing an oral health data communication plan that will ensure that OHP is sharing current data with stakeholders that will aid organizations in grant writing, defending project ideas, and communicating the importance of good oral health to their partners and the people they serve. To this end, we have already collected baseline data for the surveillance indicators for the oral health plan. We are also working with 67 schools to assess dental disease in third graders by planning the 2021-2020 Basic Screening Survey. The BSS is a population-based survey that collects data on tooth decay by having dental professionals provide screenings in selected schools. The data collected will allow Pennsylvania, for the first time ever, to have surveillance data that shows the accurate state of dental disease in children. Workforce initiatives and access to care efforts include the Rural Health Clinic Dental Expansion Project, where we partnered with the Pennsylvania Office of Rural Health to identify and recruit rural health clinics to purchase portable dental equipment that enables the provision of community-based oral health prevention services in dental health professional shortage areas. Clinics have currently been set up at 3 sites: St. Luke Miners of Schuylkill County, Meadville of Crawford County, and UPMC Cole of Potter County. Through the Oral Health Workforce Teeth Program, we've reached, in the past 15 months, 239 students in dental schools and dental hygiene programs around the state to hold a book discussion around the book Teeth by Mary Otto. The goal is to motivate these students to understand public health issues and consider practicing in locations throughout the state that have access to care issues, or to practice in locations where there are simply not enough oral health professionals. The Oral Health Workforce Dental Career Pipeline Program is targeted to high school students to promote careers in public oral health. PCOH has partnered with the Pennsylvania Area Health Education Center and Pennsylvania Health Occupations Students of America organizations to provide dental career presentations, host panel discussions, and send materials on dental careers to guidance counselors. And through our teledentistry initiative, we've partnered with St. Luke's Health System and their Rural Health Center dental staff in hometown PA for teledentistry activities. To accomplish this, PHDHPs provide dental screenings and preventive treatment using portable equipment, while the dentists perform dental exams and complete treatment plans using a teledentistry model. Our Special Needs Access to Care initiative includes our partnership with PCOH and Achieva. We have promoted and provided training about the importance of those with disabilities. The training emphasizes the personal rewards of providing practical care to both patients with disabilities and those in the Medicaid program, and gives practical tips on how practice can thrive while doing so. The goal is to enable dental practices to be more willing to treating patients with disabilities. Stakeholder engagement and statewide oral health plan implementation. The Pennsylvania Oral Health Plan 2020-2030 was approved on September 1st, 2020. The plan shows how efforts, resources, and interests can be combined to strengthen the collective capacity in Pennsylvania to ultimately prevent oral disease and assist individuals in achieving a lifetime of good oral health and overall health. As Dr. Johnson mentioned earlier, the plan contains 3 main oral health priority areas: access, prevention, and education, workforce, and lastly, infrastructure improvement. It was created by a core group of staff, and partners approved the review committee made up of stakeholder organizations. We convened the Oral Health Stakeholder Group, OHS, to encourage stakeholders to contribute to the implementation of the plan. OHS includes all oral health stakeholders who wish to partner with us to implement the plan. These meetings provide the opportunity for stakeholders to give feedback to us about plan implementation, to collaborate on initiatives, and to share best oral health evidence-based interventions with each other. We also convened the Oral Health Plan Advisory Group, OPAG, to discuss strategies to implement measurable outcomes from the plan. The OPEG consists of a diverse group of 24 members representing various stakeholder groups and geographic regions of Pennsylvania. Members include 2 representatives from the 9 sectors identified in the plan, government and policymakers, community organizations, education sector, insurance and managed care organizations, associations and coalitions, health providers, funders, community support systems, and individuals. Also included are 6 members representing content experts from state agencies. I mentioned the many grant programs earlier, but I'd like to name one that had been funded in the past. Under the Connecting Oral Health and Overall Health Program, the HealthLink Dental Clinic, located in Bucks and Montgomery County, provided blood pressure screenings at dental appointments, education, counseling, and resources to patients with high blood pressure readings, blood glucose level testing, and dental hygiene appointments, education, counseling, and resources to patients with high blood glucose levels, and medical referrals to patients with high blood glucose or high blood pressure readings. A total of 141 patients were screened for risk of diabetes during the grant period. Blood pressure testing, education, and counseling were also offered at 100% of the appointments. A total of 1,170 patients were screened for high blood pressure, and overall 19 referrals were made for patients with high blood glucose or blood pressure levels. COVID did impact the number of patients that were seen, but we hope that HealthLink will be able to return to their normal level of service. And that, again, is another example of how we're able to show the importance of oral health for overall health. Next slide, please. Looking to the future, we want to continue to diversify our funding strategies to ensure long-term program sustainability. Currently, our funding comes from CDC, HRSA, Preventive Health and Health Services Block Grant, the Pennsylvania General Assembly Legislative Special Initiatives. One strategic activity we are focusing on is diversifying our funding. Many states receive maternal and child health block grant funds, and while we were not successful in getting funding in 2020, we are hopeful that we can build a case in preparation for the application in 2025. Our HRSA funding ends August, and CDC will end August of 2023. So we are continually aware of opportunities and threats. We want to build the capacity of the oral health program. Right now, we have a staff of 3, and we rely on partnerships to advocate and implement various projects. The biggest expense is staffing, and for the kind of systems change work we do, staffing is extremely important. Unfortunately, many grants and funding resources do not focus on salary or infrastructure, but more on project outcomes. But you need staff to implement projects. We are working on getting more resources by showing how oral health is vital to overall health, leveraging partnerships with other communicable and chronic disease programs, and serving on committees and task force to demonstrate our needs, but also to show the vision and capabilities of OHP. It is a ton of work, but we are pleased with our current successes. As I hope I communicated, the oral health program is mighty but strong. Our program has come a long way since the first Oral Health Summit in 2016, and a big reason is because of our support from our partners. Department of Health leadership listens to stakeholders. They really do. Oral health has made it on the radar because of the hard work and engagement of our partners. You are the best advocates of OHP and oral health in Pennsylvania. OHP is always looking to see how we can sustain the program, grow, and change within an ever more complicated political climate. Our strategic partnerships with you and your engagement can help us make OHP stronger. OHP cannot advocate for specific laws. We can educate legislators on important oral health issues, but we cannot say pass House Bill 2027. We can educate about the need for increased Medicaid coverage for adults. We can share best practices from other states, and we can answer questions through our Office of Legislative Affairs to make sure that lawmakers have the facts when they make decisions. But again, we cannot lobby or advocate for funding for specific policies. It is crucial in this area that our stakeholders serve as a voice for OHP and other oral health related organizations. Apart from legislators, we can share success with our leadership and our funders, and that is why it's so important for you to share your stories with us so that we can demonstrate the collaborative impact of efforts in PA. Funders want to see our collaborations and our results. We must and we will continue the mission of providing optimal oral health to all Pennsylvanians in the Commonwealth. I'd like to thank everyone for your time today, and most importantly, thank you for the great work that you do by improving the oral health of all Pennsylvanians.